Have you ever heard of locked-in syndrome? Imagine this. Your brain is fully awake, but your body is completely asleep. You're fully conscious. You can hear your family talking around you. You can feel them holding your hand. But no matter how hard you try to scream or speak, no sound comes out. The only part of your body you can move is your eyes. When we see a patient in this condition, most people assume they are in a coma or completely unconscious. But what's truly frightening is that many people with locked-in syndrome are 100% awake, with a perfectly functioning mind trapped inside a motionless body. This extremely rare condition is called locked-in syndrome. So how does it happen? Think of it like a bridge. Your brain sends signals that tell your body how to move, and those signals travel through a vital structure called the brainstem. If a severe stroke damages this bridge, the connection between the brain and the body is cut off. As a result, your brain becomes trapped inside your body. The signals can no longer reach your muscles, causing paralysis of almost your entire body. In many cases, only blinking and moving the eyes up and down remain possible. This is why the condition is so dangerous. One of the biggest risks is that people may mistakenly believe the patient is unconscious and stop communicating with them. If healthcare providers and family members fail to recognize that the patient can still hear and understand everything, it can cause profound emotional distress, loneliness, and psychological trauma. In addition, if the patient is experiencing pain or another medical problem but cannot communicate it, the condition may go unnoticed and lead to serious complications that could further endanger their health. So, how do doctors communicate with someone who has locked-in syndrome? Since eye movement is often the only voluntary movement they have left, doctors and family members commonly use blinking codes. One blink for yes and two blinks for no. Today, modern technology has made communication even easier. High-tech eye-tracking computers allow some patients to type messages simply by looking at letters on a screen. The best way to prevent this condition is to recognize and treat the warning signs of a stroke as quickly as possible before the blood vessel in the brain becomes blocked or ruptures. And if you're caring for someone who has had a stroke, always speak to them with kindness and compassion. Just because they can't respond doesn't mean they can't hear you. Share this with your family and friends to help raise awareness about locked-in syndrome and follow for more medical facts.